So we now move into the cost of goods section. So our little character here is currently sitting on the VAT. So we've moved from the revenue section into the cost of goods section, and the moment we cross over here we have to pay our VAT, which is 20,000 units of money. So there's the £20,000 straight to the VAT. So at the moment we're not looking like we've got a huge amount left. So as we head into the cost of goods section, this for most team members again is a big surprise. So if we look at consumables, these are items that just come and go out of the practice. They're not drugs, they're not involved in theatre, they're just elements of the everyday running of the business. So you might want to think about things, you know, whether it's washing up powder, whether it's cleaning fluids, whether it's mop heads, whether it's pet related consumables. This is a sum of money that just has to be paid. Moving into theatre consumables, this is an area where, due to the nature of the cost of the theatre consumables, that one using 2 or 3 catheters, using 2 or 3 giving sets, using 2 or 3 items and only charging for 1, over time does create a gap in the situation. So as we move round the cost of goods section, these are all highlighting areas where the team can help manage the cost of goods. Internal lab fees, so the cost of looking at lab fees, the running costs, whether using reagents or dry chemistry or wet chemistry, all of these things, getting it right first time so that the cost of running the internal lab, bringing to everybody's attention what it actually costs. It's not just a quick blood test, there is a cost associated with that, not just in terms of the consumables, but also in terms of the trained staff, the trained team members that are going to actually utilise the lab equipment. Pet and horse food, if you hospitalise pets or horses, you will have feed costs. In the pet food, in the pet practices, you may very well be buying in food to retail out. Even so, if you don't sell a lot of food, you will be feeding in patients. And certainly this is a cost which again adds up. And so this whole cost of goods section here is what do we spend, and in reality what does it all mean. And as we move round, looking at what cremation fees involve, most of your customer care team members will be aware that you charge for cremation, individual cremation fees, because they handle that transaction. They may not be aware of the fees that you pay for theatre waste, surgical waste, any other waste that are going through the crematoria. And again, it's just bringing into focus that there is a cost associated with this. And this is not a small number. External lab fees, again, for those people handling the payments of invoices by the customers, lab fees always seem to be quite large, and we need to connect the reality of what it's actually costing you as a practice to make sure that from the team members' point of view that they don't feel embarrassed about asking for £150, £120 for pathology, histology, or some of the more specialised blood tests that you send away. Cleaning materials, you know, absolutely critical in a veterinary environment that the place is clean, especially cleaning materials, fluids, used in the right dose rates. These things again all are a cost to the business. So when we look at the cost of goods, we have a whole section here which I think would surprise most team members, is that for most of you this whole area here will be about 25% of your revenue, so that when we come to this point here, by the time we pay the wholesale bill, we pay the lab bill, the crematoria bill, you're looking at 25% of all the money through the till going out on cost of goods. And that for most team members is quite a surprise. So this is a really important section of the game. And as you can see, as we've gone through here, I've now got to pay the wholesale bill, which is £250,000. I may be struggling because I don't win enough clients on the other side. So about now, some of your team members may go, well, actually, I can't pay that bill. And the reason you can't pay that bill is you didn't win enough clients on the customer journey side. So this is a cost of goods section, a real good learning as to where all the money goes, and that you have to pay this even if you gave it all away free in the revenue section. So these two really marry up quite nicely.